Hello everyone, welcome to Health Series Podcast. Today we're going to be looking at the topic, the healthcare system of Nigeria versus Singapore healthcare system. When comparing the healthcare system of Nigeria and Singapore, the difference are striking in terms of accessibility, quality, funding, and overall outcome. In this episode, we're going to be looking at various areas where there are primary distinctions and similarities. Starting with the healthcare structure and management. The Nigerian healthcare system is a mix of public-private institutions with three tiers of healthcare services: primary, secondary, and tertiary. However, there are challenges with coordination, underfunding, and a lack of infrastructure across these levels, which leads to disparities in healthcare quality, especially between urban and rural areas. Singapore's healthcare system, on the other hand, is widely recognized for its efficiency and quality. It operates on a mixed public-private model as well, with significant government oversight. The government plays a strong role in regulating costs, maintaining a high standard of care. The healthcare system is primarily based on the 3M framework: MediSave, MediShield Life, and MediFund, which helps citizens cover medical expenses without overwhelming the system financially. When it comes to funding and financial model, healthcare in Nigeria is primarily funded through government budgets, out-of-pocket payment by patients, and some private sector funding. However, out-of-pocket expenses remain very high. Burdening low-income families. National Health Insurance Scheme was introduced in 2005. Coverage remains low, particularly in rural areas, and only a small portion of the population has got access to any form of health insurance. Singapore, on the other hand, which operate the 3M system, the MediSave, which is compulsory health savings account for all citizens of Singapore, the MediShield, which is the basic health insurance, and the MediFund, which is an endowment fund for those unable to afford care, ensures that the citizens have a structured approach to their healthcare financing. This system minimizes out-of-pocket expenses and significantly reduces the financial burden on families while maintaining universal healthcare access. When it comes to healthcare access and quality, access to healthcare is limited, particularly in rural areas where infrastructure and medical facilities are sparse. There's also a shortage of healthcare professionals, with many Nigerian trained doctors immigrating in search of better opportunities. As a result, the quality of healthcare varies widely across regions. There are significant gaps in healthcare delivery, leading to lower life expectancy and higher infant, maternal, and mortality rates. Whereas Singapore has one of the highest standards of healthcare in the world, with an emphasis on preventive care, efficient service delivery, and advanced medical technology. Access is universal, and the healthcare system is well-staffed, well-trained medical professionals, supported by strong infrastructure that makes quality care accessible to all citizens and residents of Singapore. When it comes to health outcomes and indicators, health outcomes in Nigeria are challenging, with high rates of communicable diseases, infant and mortality rates, lower lifespan expectancy compared to global averages. Malaria, HIV/AIDS, and tuberculosis remain prevalent, compounded by limited access to clean water and sanitation. Whereas Singapore's health outcomes are among the best globally. Life expectancy is high, infant and mortality and maternal mortality rates are low, and the country has effectively managed communicable diseases and chronic conditions. This success is attributed to efficient healthcare policies, high quality healthcare services, and a strong focus on public health. When it comes to the challenges and innovations, the challenges include underfunding for Nigeria, poor infrastructure, inefficient medical professionals, and a high reliance on out-of-pocket expenses. To address this, Nigeria is exploring innovations like telemedicine, mobile health clinics, and expanded health insurance coverage. There is also a push to improve primary healthcare facilities across the country, although progress is very gradual. While Singapore's system is highly effective, it also faces some challenges related to aging population and rising healthcare costs. The government has been proactive in developing solutions such as expanding the 3M framework, promoting preventive healthcare, and encouraging private sector involvement in elderly care services. In essence, Singapore's healthcare system is a model of efficiency, universal access and quality care with robust government support and financial structures. Nigeria, on the other hand, faces more complex challenges with underfunding, accessibility issues, and health disparities, though it is actively exploring innovative approaches to improve healthcare access and outcomes. Would appreciate if you like this video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.